Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on the hidden secret number 18 of why you can still have back pain. In this video, the hidden secret number 18 is due to ergonomics. Ergonomics is the science that discusses how we interact with our environment. It has to do with our bedding, our work environments, and how we adjust our chairs and how we adjust our seats in our cars. And we're going to talk about that and how it can cause back pain problems. The first place that I want to talk about is the bedding. You spend about 1/3 of your life in bed. It's hard to believe, but that's actually the truth. There are 24 hours in a day, and we're sleeping about 8 hours of those days. That's 8 hours of that day. That's about 1/3. So it makes sense that you want to protect your spine and optimize the stability to your spine while you're sleeping by choosing a good quality mattress and box spring. I get asked this all the time. What's the best type of mattress? So what's the best type of sleep set to get? And there is no best, but I do have some general recommendations. The first thing is I generally hate water beds. I don't think they're very good, and thankfully they're not very common anymore. Back in the 70s and the 80s, they were really common, and I can't even imagine how many people were suffering needlessly with back pain because of those things. But I generally like a bed that's got some good firm support. I don't like one that's too soft, and I don't like one that's too hard. I generally like one that's on the firmer side, but it's up to you. But whatever you choose, make sure that you buy one that's got two sides so that you can flip your mattress. That's important because if you don't flip and rotate your mattress on a regular interval, and the rule of thumb there is approximately every 3 months or 90 days, you're going to have pressure points that's going to develop because you're going to have little indentations in the mattress. I don't care what the manufacturer claims, eventually that mattress is going to start to break down and you're going to have little pressure points, and that's going to cause your back to hurt. You want to replace your mattress approximately every 3 to 5 years. And what's astonishing to me is I have patients coming into my office that have had the same bed for 20 years. And I don't know if it's just because nobody ever told them that they're supposed to replace it, or if money's just too tight. I don't know what the problem is, but make sure that you're flipping and rotating your mattress, and if it's more than 5 years old, it's time to get rid of it and get something new. I don't know as far as like the different brands, Sealy, Serta, Simmons, there's Original Mattress Factory. There's all kinds of different brands out there. Just shop around, find the one that speaks to you and then you get a pretty good deal on, but make sure that you're at least flipping and rotating it. Make sure you get it on both, that you can flip and rotate the mattress. A lot of these manufacturers, for a variety of reasons, decide to just sell one-sided mattresses. Don't get that. Make sure that you get the kind that has two sides on it. Okay, so the next thing we want to talk about is your chair. When you're sitting in your chair, like your chair from work, make sure that you're getting the best quality chair that you can. If you work at home, the choice is all yours. You can buy whatever you want, but go to the office supply store and sit in a bunch of different chairs and adjust them, adjust the height, adjust the tilt back. Make sure that it fits your back well. Make sure that it has a good lumbar support and perhaps has armrests and has a good support for your neck. You can't believe what a good chair will do to make you feel better at the end of an 8-hour workday versus sitting in an awful chair. Now, if you work in an office building and you don't have control over that, you can still use aftermarket lumbar supports and that you fasten to the back of the chair using an elastic cord. And you can also have a nice talk with your manager or your benefits manager about improving the quality of the chairs in your workplace. When you're working, you want to try to minimize how much downward head motion or flexion that you have, because when you tilt your head down over a long period of time, it causes tremendous amount of stress and strain on your neck and your upper back. So if you have to read off of a piece of paper or a book, invest $15 or $20 and buy a document holder. You can find them at any office supply store. They're very good. They're worth their weight in gold, and it'll minimize stress and strain on your back. Also, make sure that your computer monitor is situated directly in front of you, not off to the side, because you don't want to have to rotate and twist your spine all day long while you're working. Make sure it's right in front of you. If you have to have reference books and reference materials and other types of things, that can be put off to the side. You don't have to have that directly in front of you. Keep the computer in front of you. Okay, so let's talk about your car. In your car, all cars have an adjustable seat, but you'd be surprised at how few people actually take note of how to adjust it to their optimal level. You want to have your seat so that it's forward enough so that your feet can touch the pedals without your knee being excessively bent, but you also don't want your leg stretched out all the way. If you have the seat too far back or too far forward, over a period of time, it can cause leg pain. It can also cause chronic low back pain. So make sure you adjust the position of your seat forward and backward correctly. The tilting of this seat should not be excessively far back, shouldn't be straight up and down either. It should be slightly tilted back. And if you have a car that doesn't have a good lumbar support, buy one. Buy one that you could buy them at online, or some auto supply places sell them, that it'll give your low back some extra support. And this is very, very important, especially for people that drive all day long. Truck drivers, or people that are salespeople that are in their car all day driving from client to client. You got to make sure that you optimize the protection to your spine while you're in your car. The other thing that I recommend for optimizing ergonomics is to pay attention to your feet and to pay attention to your footwear. You want to replace your shoes, especially if you're doing a lot of walking. Make sure you don't hold on to your shoes too long, because the inserts and the protective inserts inside the shoe starts to break down pretty quickly. There are aftermarket inserts that you can use that range from the low-end stuff that you buy at the drugstore, the Dr. Scholl's things, all the way up to custom-made orthotics, like the kind that I prescribe in my office, where I put somebody on a scanner and we actually measure the arches of the feet to make sure that they're not collapsing and you don't have excessive rolling, pronation, or supination. You'd be amazed at how much that can help with back pain, especially for people that are doing a lot of walking, or people that have to stand all day long, cashiers, or people that require just to be on your feet all day long. Well, I hope you enjoyed this video, and I hope you learned something about ergonomics. If you have any questions, I can be reached through my website at redapplewellness.net. Please subscribe to my YouTube channel and tell a friend. And again, thank you very much for checking out this video.